All right. Hi. It looks like we are live. So good afternoon. My name is Yasmine-Imani McMorrin, and I'm so honored to be running for Culver City Council. For work, I work as the interim dean of students and the director of diversity, equity, and inclusion for USC Gould School of Law. And for our city, I serve as the vice chair of the General Plan Advisory Committee, and I also serve on the Equity Strategic Planning Committee for our school district. So I am so excited to welcome you all to our very first town hall centered on community well-being. If you can please share our stream out from your page or create a watch party so that more folks can join us. We're always trying to get the word out about our campaign. And don't forget to like our Facebook page so you can be, put on notice for when we're having additional events. And our campaign hashtags are hashtag Team Yasmine and hashtag Vote McMorrin. And also throughout the stream, if you have any questions, please put it in the comment section and we'll make sure to get to them. So if you've been plugged in with the campaign, we've had a couple of Connect with Yasmine events, which are like 15, 20-minute conversations, either just with me or with a guest. And so our town halls will be sort of panel style, and they'll have 2 to 3 guests focused on a particular topic area. And so the intention of these topic-specific events is to raise awareness on issues that are impacting Culver City. And so my leadership style is very much collaborative, and there are folks who are living experiences, and we want to elevate voices and expertise. And that's what we're going to do today, focused on community well-being. And so in this moment, when we are still navigating high rates of COVID in LA County, our school districts are making decisions about what education will look like in the next month, and our businesses are trying to survive and thrive during social distancing, and we're all just trying to stay healthy as much as we can, right? I'm so excited to delve more into this moment and learn more from our experts about how we are addressing it and how we might do so better. So the way this is going to go is each panelist will have a few minutes to speak about their work and share thoughts about how we can navigate this moment in the best way. We do have Gail Heberman, and she's the director of the Office of Planning for the LA County Department of Public Health, although she will not be representing the LA County Department of Public Health at this event. She's just here as a private citizen. We'll also have Jamila McGill. She's a small business owner, and Miguel Sierra, who is an education and political strategist and consultant. So I'm so honored to have everyone here today. We're gonna start off with Gail Heberman. Please take it away and share with us.
Thank you so much, Yasmine. In many ways, the title of today's town hall on community well-being is also the definition of public health. While individual health is focused on one person's well-being, public health is actually committed to strategies that promote health across populations. And in our case, the larger population would be Culver City. So I'd like to talk really briefly about public health strategies that can promote community well-being in our city, or actually any city. And it feels crazy not to talk about COVID-19 during this profound public health crisis. But I'm not really going to focus on the pandemic for today. Instead, I'd like to talk about the intersection of public health with land use, criminal justice, housing policy, and environmental policy. About 15 years ago, the public health field moved away from its focus on individual behavior. And by that, I mean healthy eating, exercising, refraining from risky behaviors such as smoking, because we saw that policies at the community level, the city level, state and federal levels profoundly impact public health and community well-being. Data and research now show us that non-health factors contribute 50% to people's health. And let me talk about what that means. By non-health factors, we're talking about policies that affect access to quality education, access to housing, access to jobs, as well as the environment that people live in. All of those factors make up 50% of someone's health status. Obviously, access to healthcare and one's genetics also impact population health. We know that city policies and physical environment affects people's choices whether to exercise and eat healthy. So for example, people's decision to exercise is influenced by whether their neighborhood streets are safe for biking and walking and they feel like they can actually take a walk or bike. Also, whether there's key destinations like small businesses and markets and stores that they can walk to instead of drive to, whether they can walk to a neighborhood park. Also, people's decisions about healthy eating is influenced by whether there's even a grocery store nearby that sells healthy, affordable food, or if they have to shop instead at a convenience store that may not carry healthy products, which is the case for so many communities in LA County. We call these neighborhoods food deserts. In addition, cities make decisions about affordable housing, criminal justice, and environmental health that impact families and communities deeply. And I'm just going to touch really briefly upon those areas. Affordable housing and community well-being are inextricably linked. We know that the data show that when people pay significant portions of modest earnings for rent, they forego taking their kids to the doctor or buying healthy food, which negatively impacts their health. Overcrowded situations when people have to live with another family or an extended family also can put people at greater risk for developing chronic disease and mental illness. And also moving frequently because you can't afford the rent, so you move to Riverside and then commute back in. That has negative impacts, especially on children whose school performance can drop. And also kids can engage in riskier behavior when they have to move and set up a whole new community in a new school district. Cities have the power to enact a wide range of policies that can increase access to affordable housing and preserve existing affordable housing. And we all know Culver City has struggled with this issue and has really done some amazing policies. Decades-long housing policies based on racism, specifically to exclude Black people from owning homes and living in the same neighborhood as white people, have created segregated neighborhoods throughout LA County. And not surprisingly, many of our poorer neighborhoods, now home to working-class Black and Latino families, have fewer parks. Their schools have fewer resources than schools in middle-class neighborhoods. And they also face disproportionate exposure to toxic industrial emissions because cities are choosing to place industrial uses close to lower income communities. All of these are examples of intentional city policies, some that create enormous inequities in access to wealth, resources, and health. Really briefly, I want to talk about criminal justice and public health, specifically about diverting people to healthcare instead of incarcerating them. Our country is facing a crisis of mass incarceration, and LA County operates the largest jail system in the US. Prior to COVID, we had 17,000 people in custody in our county jail. Fortunately, this number has decreased because during the pandemic, we did release people who are incarcerated for lesser crimes in order to protect their health, because prisons are places where obviously the virus can spread. Approximately a third of all people in our county jail prior to COVID have a serious mental disorder, and it's an even higher percentage when you combine that with people in jail who have substance use disorders. Our country's policies have put people in jail for decades who live with an addiction which public health considers an illness, or who live with mental illness. And our country's justice system is disproportionately impacting people of color. 74% of people arrested in LA County are Black and Latino, while only 9% of LA County residents are Black and 49% are Latino. Our country faces the heartbreaking reality of starkly different treatment, arrest, and incarceration based on race. It's important to remember the public health implications. Children and family members often experience trauma by what they witness, by losing a parent to incarceration. Families lose a breadwinner and suffer economic instability for many years. And that's just a snapshot of what families go through when someone's incarcerated. So the new focus for the LA County Board of Supervisors is diverting people to care who really need substance use treatment and really need mental health treatment. Although there's a host of other criminal justice issues that we all know about, including police brutality that we're all grappling with. Lastly, really quickly, I just want to touch upon protecting public health near oil drilling sites and environmental justice. In LA County, we have 3,000 active wells, and we've got active wells right here in Culver City. And while it's frustrating because we don't do the long-term studies necessary to show causality between a exposure to an oil drilling site and health impacts, more data has emerged in the last few years. And I'd also just like to pause to say it's unfortunate that we don't take a precautionary stance in this country where we say, okay, we don't have the data, so why would we ever approve placing toxic emissions like an oil drilling site? Why would we ever place that in close proximity? Because we don't have the data to prove that it's safe. Instead, we put the onus on people to prove that there are health problems that could emerge result from their proximity to these sites. So we have a long way to go, I think, in terms of environmental justice. But there is now evidence that air pollution that is resulting from oil and gas production creates small particles that pollute the air, and eye, nose, and throat irritation, headaches, dizziness, and breathing problems, including asthma, can ensue. Long-term inhalation of large amounts of these particles can lead to an increased risk of cancer or babies being born early or too small. And this isn't even mentioning the bad odors, the vibrations, and the emergencies that can happen because of accidents like chemical spills, fires, and explosions. So I'm going to stop there, and that's my public health at a glance.
Oh my goodness, you've given us so much. Thank you so much, Gail. We're going to pivot over to Jamila to discuss a little bit about small business and community well-being.
Hello, everyone. Again, my name is Jamila McGill. I am the co-owner of Brooklyn Tea. It is a tea shop based in Bed-Stuy, Brooklyn. And so I feel like I can talk at it from a couple of different angles. I'm going to choose to speak about business in terms of community and the impact of COVID-19. So we're a company that is about a year and a half. And so in January, we had just turned a year old. We're starting to pick up steam. We're starting to get the customers that we want to see. And it's like, okay, this is starting to make sense. This is like starting to align with our vision. And then March hit. And so business as usual was basically stunted. And for good reason, people were asked to stay home. And so sales were drastically impacted. So some days we had 50% decrease in sales. Sometimes we had 85% decrease in sales. And during that time, we got to see a lot of what our community was built, or how our community was built. Because without their participation and their engagement with us, we definitely would be facing closure at this point. And so that makes me think a lot about how businesses are positioning themselves to be a part of development and not gentrification. How are you letting your community see themselves in your business? And knowing that Sophia in 5th grade has her dance recital, knowing that this mom needs mother's milk tea because she's struggling with breastfeeding, all of those nuanced conversations and relationships, they solidify us in a community. So when COVID-19 did hit and we were asked to have fewer staff, have fewer hours, all those things started to happen, we still had the community rallying behind us because they wanted to see us come out on the other end of this. Now, by no means did that make it easy. Did it feel like less of a, it felt like less of a blow to see the sales dwindle, but in so many ways we had community members bring us lunch so we wouldn't have to worry about trying to get up money for that. And so that just makes me think about the importance again of businesses and making sure they have a clear vision for who they are with the neighborhood. And that's even from attending community board meetings. They know Brooklyn T. Jamila is going to be there at the community board meetings to say her piece, whether they, whether it's going to the neighborhood schools career fair, right? Those things have helped us in the long run to stay strong during these very trying times. Other things that have been pivotal are is leaning on our council members. So here we have Council Member Cornegie, knowing that a council member is out there creating an IG Live or a Facebook Live to talk with us, to the community, so people know of ways to engage with us, whether that's shopping online at brooklynt.com, or if that's we're doing pickup and takeout at the shop. And so it's very vital to have those strong relationships with your local government, with our local government, because they help to see us through in many ways too. Just from things of like having extra masks, right? Because that becomes a heavy expense and burden on small business owners. If you want to keep your staff safe, but how that depletes already low sales in that way, it's nice to know that your community board or your council members are taking care of you in that way, even down to hand sanitizers for customers that are coming in. Other ways that we have experienced or have had experience with COVID is knowing how best to pivot. And that's been a lot of trial and error, probably more error than successes at this point. We've really been lucky that we have a product that can carry and deliver online. And so I would encourage anyone who's out there who's struggling as a business to see what can you do out there to turn whatever service that you're providing into a product that you can sell online. And then that's about it.
Thank you so much, Jamila. We're also now going to shift over to Miguel Figuera, who's going to talk to us a little about education during this moment.
Thank you, Yasmine, for having me. My name is Miguel Angel Segura, and I work in educational policy and advocacy. I was born and raised here in LA, Westlake Echo Park. And what I do is that I look for parents and work for different organizations. I've worked for a couple of elected officials, so I'm very grounded with the community. And what I do is that I help parents advocate for themselves and for their kids. What I've seen is that a lot of parents don't know how to advocate. I grew up in a very low-income community, and my parents didn't know how to advocate for a better education for myself. So if a parent needs help with an IEP, with English learners, they need to pass a test, with anything that they need support, I've been on that side of the school district within LAUSD. And I know the ins and outs. I know the people. I've worked in politics for a long time, so I know the ins and outs of that. So that's during a regular time. During the pandemic, we realized that we went virtual. Our students within LAUSD and other districts completely went virtual, and our neediest communities were left without any resources. First, the first thing we saw is that they went virtual, but our families did not have internet. We realized that they needed basic needs. There were Pampers ran out, wipes ran out. There was so much happening. So with the organization I was working for and the community, since I'm very grounded, we got together. We started delivering toilet paper, wipes. We started supporting our moms to call to get free internet. Then the issue, what happened was that once we had internet, now we needed to advocate and teach our parents what was happening with the teachers, how many instruction was being missed. A lot of our kids were missing instruction, and it had to do with the teachers not knowing what was happening, the districts not knowing what was happening. And this happened throughout California. This happened in every single district. People were trying to see, how are we going to give instruction to our kids? there are what we found out with the survey that we did in the community is that a lot of our wealthy communities, they had tutors, they had a lot of going on, but our neediest communities in the Southeast and South LA and downtown LA, we're not getting these resources. We're not getting instruction. We're not getting private tutors. So we had to come up with something else in the organization I was working with. We had to find tutors for these kids. So we started finding out that all these needs within the community, and this is the educational gap that a lot of folks have been fighting for a long time, and we continue to fight for people of color, and we're going to continue fighting. So I teach parents how to advocate. I'm going to continue doing this type of work because I love it, and that's pretty much it. We'll see what happens. We know that the governor said we won't be coming back. Next year, we're going to be still doing virtual learning, hopefully with the contracts and everything happening behind doors with the unions, that we find out that we get more instruction and we get more support for our low-income communities. And that's all.
Thank you so much, Miguel. All right, so we've got tons of information. We're just going to sort of pivot into some questions now. And don't forget, if you have specific questions for our panelists or for me, make sure to place it in the chat so we can address it. Gail, my first one is for you. So you spoke a little bit about this earlier in terms of, exercising and making sure people have active bike lanes and can traverse our cities, safely. So how important is it to public health for Culver City to have bike and active transportation lanes, plus safer pedestrian walkways and improved crosswalks? I'm a new Fox Hills resident, and I know lots of us in this area are always, trying to find more safer ways to get around our community. So I just wanted to know a little bit more of your thoughts on that.
Yeah, thanks, Yasmine. That's a great question. I like to start when I talk about why it's so important to design streets for safe biking and walking. I like to start with the data. For young children in LA County, traffic collisions are the leading cause of death. So while sometimes when I'm out in communities, they talk about access to jobs and affordable housing as their biggest need, and it's important to always follow the lead of the community, it's also sometimes surprising for people to learn that this is how our children are dying, and it may not be large numbers of people, but our kids are dying. This is the leading cause of death, being hit by a car. So we also know after years of research that when you design streets for safe biking and walking, which means slowing down car travel, building ideally a protected bike lane with some kind of barrier between the bikers and cars, wider sidewalks, we know that there are fewer collisions between cars and pedestrians and cyclists. So I think it's hugely important, not to mention all the environmental reasons for getting people out of their cars and walking and biking. So there's so many reasons. It's a life and death issue. It's the right thing to do environmentally. And if people will bike and walk 30 minutes a day, you reap the public health benefits of cardiovascular health. And that can be 10 minutes biking to the grocery store or the mailbox and 10 minutes biking to school. So hugely important.
Sure. Thank you. Jamila, what are some ways that smallish cities like ours in Culver City can provide support for businesses to address economic impacts due to COVID-19? I know you spoke about having PPE and providing, hand sanitizer, et cetera, things that you've experienced, but do you have any other ideas or anything that you've experienced there that we might be able to share out here? Oh, you're on mute, Boop.
I'm back. So if being a customer is such a position of strength, because you engage different business owners throughout the course of the day, throughout the course of the week. And what I found to be very helpful as a small business owner is having the customer or council member or whoever connect me with other small businesses, so that we can have collaboration. So some examples of that, A customer connected me with a wine store, which, as a tea shop, I didn't see the connection right away, but we ended up doing raffle gift sets together, and that helped both of us tremendously. And being able to utilize the power of Instagram and Facebook to host conversations with different small businesses, because they're interested to know, because your customers love you, they're interested to know what's going on. And so when you get a group of 4 or 5 of you together and create a Zoom party around that, that helps to bolster everyone's businesses. So collaboration has been essential. And so no matter if you're a small business, find ways to get yourself out there, connect with other businesses. If you're just a customer, find ways to get those businesses to talk to each other. COVID has been a time where I've spoken to more small business owners in this 3 to 4 months than I have done in the past 2 years. And that was eye-opening, and a bit for a part of me felt a little shameful that I hadn't done the work to reach out prior to. But now that we're here, we're seeing how relying on each other and having that healthy sense of like codependence in the community helps us all to survive and thrive. So that I would start there. That's like something simple. Connect the business to another business.
Thank you. Miguel, students in Culver City have risen to this moment and provided extraordinary leadership, from hosting protests to, advocating for more curriculum changes, or more inclusive curriculum rather changes. So I know you primarily work with parents, but what advice do you have for students in this moment who are advocating for changes, more progressive changes in our school district? Or in our city overall, not even just the school district.
I would tell the students of Culver City within the district that keep advocating, let your voices be heard. This is a time of change all over the country. And if you want your curriculum to change, don't stop. Just keep getting support from teachers, keep getting support from your parents. So you guys have social media. I wish we had social media back in the day in high school, and we probably would have done a bigger change. But this moment's your moment, and just keep fighting the good fight.
Sure. Thank you, Miguel. Gail, we're going to come back to you. So what do you think are the most effective ways? So you talked a lot about, how effective, and honestly, it's what I believe policy shapes so much about how we experience our health. Housing is public health, especially right now in this moment, how we traverse our city. I mean, all of it is public health. And so what do you think are the best ways to bring all stakeholders to the table, given that certain groups in our community have long been excluded or not listened to?
Yeah, I think it's been challenging for a lot of local governments to effectively engage people in the decisions that impact their health. I think that it's not always necessary to bring everyone to the same table. What we've done in public health is sometimes, if people have been excluded from previous policy decisions, instead of bringing them to a county meeting or a city meeting, we go out to meet them where they are. And I'll give you an example of that. When working on the Alternatives to Incarceration work in 2019, we wanted to make sure that in our policy recommendations to the Board of Supervisors, we were including ideas from formerly incarcerated individuals in LA County. So we held some focus groups in jails with currently incarcerated people, and we held meetings in 7 communities that were hosted by community-based organizations that were trusted by formerly incarcerated people who may not have come to a meeting had they seen a flyer from the County of LA. And so I think you need to build partnerships with the organizations and the community leaders that people trust, and be creative in terms of engagement through them, whether that's a faith leader, some kind of civic leader, whoever it is.
I think that's a lot what we're trying to do with the general plan. We're having community listening sessions, and it's very different, in this time of COVID, where we can no longer physically gather, but still having surveys and still having, virtual meetings. But very much our approach has been meeting people where they are, having listening sessions, and inviting people to contribute and wherever we can. So I definitely agree. Thank you so much. Jamila, you alluded a little bit to like collaboration and making sure that as local government or as just as community in general, we're making sure that we're aware of the resources or other businesses that can collaborate, et cetera, et cetera. So how have you gave us an example of partnering with a wine business, but are there any other ideas that you have for our small businesses here in Culver City to attract, serve, and retain customers throughout this pandemic?
So again, I would kind of go back to taking advantage of the social media platforms. That's where we pretty much all are at this point because of the lack of mobility, right? So how are we leveraging your IG lives, your Zoom parties? For us, is hosting virtual tea tastings because we can't do that in person. Just thinking about how you can pivot the things that stand out and make your business special and how you can put that on a digital platform. It could be as simple as becoming the host of an IG Live. So your job is to introduce or to speak to other businesses that are in your same industry. We've done that. So there's another very popular Black-owned tea company called Ivy Co. and Just Add Honey, and we've had IGTVs where we've invited them to come speak with our base because it's about collaboration, not competition. So don't think about the business that is in your same industry as a competitor. Think about how you all can join in, have the same conversation, and share the mic. And it creates a very interesting, fun dynamic to have and for your customers to get to experience. So again, use Zoom to its fullest extent and power in every platform out there.
Thank you. Definitely good ideas. I wouldn't think about collaborating within industry, so that's awesome. Thank you. Miguel, in Culver City, many students attend our schools by permit. So what advice can you offer for these families to ensure their concerns are given equitable treatment?
What do you mean when they is there a waiting list, or how does that?
Yeah. So basically how it works is you normally attend the schools, normally if you are a Culver City resident, but our students who attend via permit, they might not live here in Culver City. They might, maybe live in Mar Vista or Inglewood or LA. And they're coming into our schools. So they're having different, they're not in our immediate community. Obviously they're in our school community, but they might have transportation concerns or, maybe, in terms of the Wi-Fi access or, all these sort of equity concerns that are coming up in this virtual arena that we're in. Like how can, and I guess this goes more to parent advocacy, but also for our students, right? How can we make sure that their voices are being heard and they're going to be able to navigate this new platform or this new normal?
Yeah, so the biggest thing is that we have to know that right now during these times, a lot of companies are giving free internet. That's number one. Make sure that you get your 3 months and that we're in a pandemic and you take advantage of these resources that are free right now. So we would have to work with Culver City School District to make sure that they give a memo out and they give information out to these students. When it comes to transportation, is there any way that we're not going to have transportation right now, but in the future, giving resources for those students that have to take transportation could work. They're subsidized, get something needs to the district they could ask for it. And I think that when students come together and start advocating for something they want, for the most part, once they get parents behind them, I believe a lot of districts start listening.
Yeah. Now is the well, thank you so much. I mean, this is such a rich conversation. Was there anything that didn't come out in our questions that anyone wanted to share? And do we have any comments from the audience as well? I know someone's monitoring that. So if you guys can let me know. Okay, Michelle is asking, this is really cool. In the time of COVID, might still be in effect after November 3rd. Yes, that's very likely. Where do I stand on a mask mandate? Do I believe in finding people who do not wear masks in the same way that West Hollywood and Santa Monica is doing? Well, I'm always really hesitant to, because it's like, what is the cause? Is the cause, poverty, or do people not have access to masks, and are we finding people who are just experiencing, a lack of access, or, is it people, because, that there's that camp, and then there are people who are just, not choosing to wear a mask. And I guess it really stems from sort of this phenomenon of how do you get people to care about other people? How do you get people to buy into public health and caring about our community? That's like a bigger issue that's harder to tackle. But on first glance, I'm pretty against criminalizing, things that are rooted down into access. And I guess it's hard to sort of see where that base is coming from. So that's just probably not. But, we do want people to be safe. We do, I, of course, encourage people to wear masks and to stay 6 feet apart, wash your hands as much as possible. I mean, it's the smallest thing that we can do to ensure that folks remain safe. So I would say no right now, because I'm really cautious about penalizing people for lack of access. But if we're giving out masks and there's like we are doing on the Culver City buses, et cetera, and people are refusing, I think that might be a conversation that we should have, because we're putting everyone at risk because of, people's individualism, which is going to harm all of us, which is really sad, which is not in the spirit of community well-being, which is what we're talking about today. Are there any other questions, or was there anything else that you guys wanted to share today with our audience? Okay, so I don't see any more questions. So we do want to be respectful of your time. So again, I have deep appreciation for Gail, Jamila, Miguel. This was really rich. I really, really appreciate you guys being here with me. So in the spirit of this being a campaign, I have to intentionally pivot to the ask. It's the part that is least comfortable for me, but it's so necessary. What we know about campaigns and fundraising is often synonymous with, a candidate's viability and our system. And we also know that female candidates have struggled to raise as much money as men. Although, we're almost half of the U.S. population, we do not hold that representation in our House and Congress. And, so we're getting there. We're making strides. And, from the state to the local level, we're getting there. And I hope to break ceilings of my own. I would be the first Black woman to be on our Culver City Council. So I am asking you to stand with me, to join Team Yasmine, to support me. You can visit the link that is right below me, McMorrin for Culver City, or Vote McMorrin. It goes to the same place, just a little shorter. And give a donation of any sort. I know that during this time is always a weird time to ask for money, but it really supports us. It helps us invest in yard signs, mailers. It helps us get the word out. And we're going to be, putting out ads and things of that nature because, I'm a different kind of candidate for Culver City, but my heart is in it. And we're really going to make sure that equity is at the center, right? For folks who come up to Culver City, we want to make sure whether you work, play, or live here, that you experience a community that is welcoming, where you feel included, and where you can thrive, right? So I would deeply appreciate a donation of any sort. So please head over and support me today. And if you are unable to give today, you can still head to that website and sign up to support, sign up to endorse, sign up to volunteer. So there are many ways also to join Team Yasmine, even if you're unable to give a donation today. So that is really our program today. I am so deeply, deeply, deeply grateful for the time that you all have spent. I'm so grateful again to our panelists, Miguel Segura, Jamila McGill of Brooklyn Tea, and Gail Heberman for your expertise, for your time, and just sharing with us. I mean, we can learn no matter where folks are, and I'm so grateful to have heard from your expertise and your experience, your lived experience today. And I think our community will be better because of it. So thank you so much. And we will see you again for the next one, you guys. Thank you. Have a wonderful Sunday. I appreciate you spending time with us. Take care of yourself. Wear a mask, wash your hands, be safe. Take care.